Hi, welcome to Dr. G Pediatrics. I am Dr. G. Welcome to my channel. Today's question, Ask Dr. G question, is a newborn with COVID, whether they need to be seen. So stay tuned. I'm going to answer that question and give some reasoning why I feel that way. Is Dr. G, my 2-month-old just tested positive for COVID-19. I have it. My husband has it. We're in the house. Does he or she need to be seen in person? And my answer to that would be yes. And the reason why I say that now is because this is further down towards the road of the pandemic, where we have access to home tests. So that's probably how the baby was diagnosed with COVID. And then a lot of healthcare professionals are now COVID vaccinated. So there's not that same type of quarantine or concern, or, whether they need to be seen in person or should I be home isolating still. But beside that, I think the important reason for saying your infant as a 2-month-old should be seen with a COVID positive diagnosis is because of their age. That's super important. So an infant less than 3 months, we have just a higher level of caution for in regards to assessing things like subtleties in their physical exam and their weight and things like that. So if your child has that, the baby has they're COVID-19 positive, then I think an exam is important, because that's going to create, to me, a baseline of what this baby looked like in the very beginning phases. And that may be it. The baby may remain totally asymptomatic. The baby may have mild symptoms. That is what we would be hoping for. But in case the baby is not feeding, the baby starts developing changes in regards to symptoms, coughing, difficulty breathing, things like that, we can compare the visit when they first came in, make sure that their weight's okay, there's nothing out of whack with their vital signs, being their blood pressure, heart rate, respiratory rate, oxygen level, checking their weight, so that if there's a change a couple of days later and the parent is concerned or the baby's not feeding, I can see that baby again and say, okay, well, yeah, there's been like a 8-ounce weight loss or something like that. So I would say if your newborn, which is considered usually less than 3 months of age, has been diagnosed with COVID-19 and if it's done at home, then I would want that child to be assessed within like the next 24 hours, right? So if you did the home test and you're like, okay, do they need to come in? I would say yes, call the pediatrician in the morning and have the baby come in to be seen. Obviously, if the baby was diagnosed at the pediatrician's office or the urgent care office, the emergency department, then they likely don't need to be seen immediately afterwards at their primary care doctors. But if you've done an at-home COVID-19 test and your newborn tested positive, I think it is important for them to have that baseline exam at the pediatrician's office the following day or the same day if they could be seen for that baseline exam to kind of really get an assessment of what's going on with baby. So I hope you guys found that helpful. If you did, please like or subscribe. Till next time, stay great. Have an awesome day. Bye.